Good afternoon. Happy Thursday, everybody. Hopefully, oh, perfect. Just got my thumbs up. We're good to go. So, welcome everybody to our webinar today. This is probably one of the biggest and hottest topics right now as far as getting kind of back to what our new normal even is, since none of us really know. So we're really excited to go over returning to work, how that's going to look. Keep in mind, this is different for everybody. Every business is different. We are different, most certainly than, some of our other partners in the industry and just how we're doing that. So, we've got some of our staff working remotely. I am one of those working remotely right now. We've got staff at the office working. And, when talking about how do we continue to keep them safe, because there were definitely points of time we've always had staff at the office. We've not been able to fully work remote. So, it's about kind of learning the new, keeping things clean and keeping things, rolling as far as social distancing and how do we follow all the guidelines we possibly can. So we are super excited to kind of go into some things today. So we'll go ahead and get started. If you have not attended a Journey webinar before, these are something we try to do once a month. We try to throw in things that aren't necessarily always related to services. So we want to be able to kind of share insights on what's going on and ways that we can help. So where did we get the resources? Please know there is a slew of information out there right now. There are so many different things going on as far as who knows what and who's saying what and who's pushing out what when it comes to the information. So all of the information was collected from the White House, CDC, and other government websites regarding COVID-19. If your state still has restrictions in place, ensure you're following your state and city guidelines by going to those sites. So check into your sites. I can't stress that enough. We've got so many restaurant clients that, and I do see some attending this webinar today. So, make sure. I know that there are a lot of different restrictions for you guys, and bless your souls. I'm working just as hard as you guys to try and push as much as we possibly can with partnerships and different authorities to get you guys operating with as much capacity, keeping in mind social distancing, and other safety requirements. So, most certainly check with your state and city because they're going to have a lot more specifics. And keep in mind too, everybody wants to get back. Everybody's eager to get back at it, but you got to do so with all precautions in place. One of the things, I talked to a client the other day who was like, I cannot tell you how much I'm looking forward to getting back to normal. And it made me kind of start thinking, what is normal anymore anyways? Like what even will normal look like? I don't know if I know the answer to that. I don't know if anybody does right now. So it's just kind of a matter of, how do we get to a new normalcy and what's that going to look like and how do we all follow guidelines to stay safe? So planning for your reopening, before anybody reopens, regardless of the industry you're in, or if you're already open or never closed in the first place, you still need to have a plan in place. This is something that at Journey, our ownership team, we have worked so tirelessly on. How do we get a plan in place that makes sense? And I will tell you that plan has changed. We most certainly have not at all been able to have one plan and it just be, this is what it is. It's been amended several times for the simple fact that things are changing daily. So, it's good to have a plan in place, but it's also good to know and understand that plan very well could change. Hazard assessments based on public contact, job duties, et cetera. That is one thing to keep in mind is how that's going to look. But it's going to be different for everybody, right? We can't have, payroll is not going to be the same as restaurants. Proper hygiene. This is something that, I truly feel like there have always been people, we've washed our hands for years, right? Decades. I mean, this is nothing new. So having proper hygiene is so important right now. Hand washing, it should have been something people were following in the beginning, but now it's, how long are we hand washing? What are the proper hand washing techniques? But, making sure that you encourage proper hand washing, provide disinfectants, sanitizers, any other cleaning materials you possibly can to make sure that your workplace is and continues to stay, as sanitized as possible. Social distancing, this one, you guys, I know it's hard. It hits hard. It's hard to do. But it is good to ensure that your employees are able to maintain proper social distancing, make signs and instructions to help them understand that and follow it. If you've been to the grocery store, you've seen the signage on the floor. You've seen the one-ways. You've seen the stand here for proper social distancing, marking it at that 6-foot mark. However, I'll be honest too, there's certain places in our office that it is absolutely impossible to keep 6 feet apart. So we've just had to really step up our sanitizing and cleaning at that point. And, if somebody's in an area that's, pretty confined, wait to go in there. Let's not have 3 people standing in an area where we cannot maintain proper social distancing. So it's just this is a matter of just trying to do what is absolutely best for your company, but also what is possible. Isolating sick or exposed employees. We just rolled out a policy that was updated to our office, including travel, any children or household, anybody in your household that's traveling. And then how does that work? How does that look? I mean, our ownership team, I'm not even kidding you, when we were going through this earlier this week, it's literally one of those conversations that you're like, I can't even believe we're having this conversation. But we have to have these conversations. So if you've got an employee that's sick, I mean, think about how it could, go through your entire staff, and what is that going to look like for your business? So these are very real conversations that need to happen and take place if they're not already taking place. Protocols for returning to work after isolation. If you've got an employee that's out, what does that look like when they come back? How do you ensure that your other employees are feeling safe about that as well? But also the employee, how are you going to make sure they feel safe? And then making sure that you have enough information and training available to all of your employees. That's such a key part of this. It's just making sure that you have the information available. So slow and steady wins the race. This term could not be more appropriate for this. Jumping back in can hurt your business. We all know that, right? If we just throw everything into our office right now and we put everybody back and we act like this is nothing that should still be taken serious, that could most certainly affect our safety. So what do you need to make sure happens when opening? Have your company policies and procedures in place regarding COVID-19, ensuring all are within federal, state, and local, if applicable, regulations. This is where, again, really look to regulations that are within the state, as well as your local ones. Everybody is different. Every county is different. Every state is different. There are even local municipalities that are different. So make sure to check everything when putting these policies in place. Conduct temperature checks where and when you can. We got a temperature thermometer for our or a temperature gauge, I should say, for our office. It's something that we wanted to make sure, are we ensuring that everybody that comes into the office is safe and protected? And symptom checks. Put up symptom checks everywhere. Put them up, print them out, put them in places where your employees always constantly have them, but also don't scare them. There are so many things going around too right now this time of year with allergies that could very well be similar symptoms. So you want to make sure that you're not scaring people into thinking that they've got it or that they've got symptoms of it if it could be allergies. So there are some really great features out there where also we were able to kind of locate a couple different things that distinguishes, okay, these are allergies and these are symptoms of COVID-19, and there are differences. So maybe even looking at something that could be like a side by side for your staff. Provide personal protective equipment, PPE. Provide it for employees where you can. Gloves, masks. They are coming back into stock. I was able to get some for our office at Office Depot. Places do have stuff coming back into stock, so it's nice to have it. I have not, though. There are so many cute masks that people have, and you can go to Target and pick up masks that are different colors. You can have ones, made for you. I mean, there are so many places that have jumped on board with this. So, we made it fun for our staff. Hey, if you have fun masks that you want to bring in, bring them in. If you feel like wearing it, wear it. If you're not comfortable wearing it and you're comfortable sitting at your desk without being close to others, that's fine too. Draw faces on them. I was at the doctor's office with my with some family members last week, and somebody had a face with teeth drawn on it. It's fun. Make it fun if they need to. Practice social distancing, especially in common areas, break rooms, lunch rooms, close areas where people are really, there is not a lot of social distancing. I mentioned this before. Just be smart about it. You can test employees that have had contact with COVID-19 or displayed symptoms before they return to work. So if you've got an employee that has been in contact with somebody who does have it, you can test employees. And again, fine line, right? You don't want to put people in an uncomfortable situation. But again, this is where you need to be open. Also, check with your HR resources. There are most certainly things that we can and cannot do as a company when it comes to COVID-19. And then assess employees' risk or exposure, especially if they've been in contact with somebody that tested positive. Just really, do some different assessments to make sure that, again, what's going to work for my business might not work for yours. So it's best to just kind of come up with something that is going to work. Have hand sanitizer and other sanitizing agents available. Again, this is not something that should be, new to anybody. Really have what you can available. Increase your cleaning and disinfecting in common areas. This is something we have stepped up at Journey. On the hour, everybody is disinfecting and cleaning, and that's just because there are certain areas, again, that we cannot keep people out of, and so they're just getting cleaned a lot more. Again, if an employee is displaying symptoms, they need to be home. They need to stay home until they've been cleared. And if employees travel for work, minimize it or stop it altogether if possible. Any travel right now that you put your employees at risk for, it's opening up so many things that could then come back. It also is putting that employee at risk, right? How vital is it that they travel? And if it's okay that they don't travel, look at stopping that for a while, because you don't want to have something happen to your employee. You also don't want something brought back. So just make sure you're following those guidelines. And so talking about alternatives, there are most certainly a ton of alternatives. And if anything, I have seen COVID-19 bring out the most creative ways of interacting and creative ways of keeping people together when we have to be apart. Working from home. I cannot tell you how many clients have called us and said, we are getting rid of our brick and mortar. All of our employees will be working from home. All of our employees can work from home. And we've had some that say, they're actually more efficient at home. So there are definitely things that need to be taken into consideration. And again, it's going to differ for every business. For employees that are working at home without issue, continue letting them do so. It's a great test to see, hey, what is this helping them? This is at least a decrease to the number of employees you have in your workplace at any given time. We do also, on the flip side, we do also know there might be some that this is just not working. We've got some that have kids at home that it's just not as efficient. So for them, it doesn't work. But for those that it does work for, it's been amazing and it's been great. Team meetings. So we know work can't stop, right? Life can't stop. Business can't stop. We don't want it to stop. So team meetings are a huge thing and they're important. But rather than having employees gather all together to cover meetings and agendas, use video conferencing, Zoom, make it fun, have people have backgrounds on there. It's a really fun, you have to get creative. I've seen some of our clients do themed meetings where everybody shows up at Zoom, on their Zoom, wearing costumes, wearing hats, making it fun so that people are still staying interacted or still staying together. They're interacting. They're still creating that great culture. They're just not doing it, unsafely. And you can also have individuals arrive and sit according to social distancing guidelines. So if it is incredibly important that everybody be together, just make sure you're doing it with social distancing guidelines in place. And then sales. So, we have sales at Journey. I mean, being in sales myself, there's a lot of different sales people and sales approaches, right? I can do my job remotely. I can also do a lot of my job via Zoom meetings. I miss the face-to-face. I'll tell you, I am a people person. I love to get out. I love to meet people. I love to shake hands, sit together, talk about things, have coffee together, have lunch together. I like that. It's something that I've had to realize it's on hold, and I don't know when that's going to happen again. But I can have Zoom meetings and get creative with Zoom meetings, have your coffee appointments over Zoom, have your lunches over Zoom if you really need to, but really just, happy hours over Zoom. I mean, gosh, it's at least you're being super safe and staying at home when you're having a cocktail. So, it's different things that you can do to keep things going. We just have to get creative. And things like apartment complexes, car dealerships. My neighbor had a car delivered to them. They actually delivered it. It was cleaned. It was sanitized. They were able to deliver it. They had the masks on for the paperwork. They did the paperwork out in their front yard, signed things, and we're done. So it's amazing that they're able to do things and do things with showings that have turned virtual. So virtual tours of apartment complexes and home buying and you name it, it's changed. But, it is something that you can most certainly get done. And then, making sure that you have the proper accommodations for employees is very key right now. Employers should make appropriate accommodations for their vulnerable employees. If you've got employees who have health issues, who have, things that prevent them from being around a lot of people, it's important to make sure that you have accommodations for them. This includes employees within the vulnerable populations, people at higher risk for severe illness, people with diabetes, people with asthma, older employees, people who are immunocompromised. This hits home for several of us at Journey. We've got, people with asthma that most certainly are at high risk. We've got people at the office that have family members that are immunocompromised. I am one of them. My father had a double lung transplant last year, which was a big deal for us and our family, and he's doing fantastic. His work has allowed him to be at home. My mother's work has allowed her to be at home so that they're not bringing things into the house. We've done what we need to do as far as getting them groceries and whatnot, but it is imperative that I remain, away from people that could very well bring it to me, which I could take it to them. So it's, it's something that you have to make sure that you have those accommodations set up and have those conversations with your employees. There could be some that, they're not worried about it or they want to continue working at the office. And there are some that, might just not feel as safe. So make sure that you're accommodating those that need it. Okay. Specific industries that we've seen, I mean, I bring up my restaurant clients all the time. They're not the only ones. Gyms, fitness clubs, they're getting hit hard. Our lodging industry, they're getting hit hard. I mean, there's a lot of places that, unfortunately are getting hit harder. Our restaurant clients, I think they've just been in the news a lot more for what's been put in place, and they're struggling to stay afloat. So if you can, support them. But as they start seeing some guidelines lifted, it includes limiting the number of guests that are there. It includes spacing those tables apart, which for them, they're losing money. So it's just a matter of making sure that you're doing your part. And requiring, the certain things that are required in order to make sure that you can open safely, but also let's get things, moving forward because things are leveling out. So it's important all around. Dental, eye care, other medical offices, these are more that have seen a big hit when it comes to this. So, as these places are opening up, it's good to make sure that practices are being taken seriously. I know that our dental industry and our dental clients, they've seen, the need for temperatures to be taken before they start working on clients. I think that's great. Which instruments can be disposed of, which have to be reused, and how are they getting sanitized? It's great questions to bring up with your your medical professionals that you're seeing. When was the last time this was sanitized? What is the sanitizing procedure like? And, making sure that people are not holding off on medical or dental issues that need to be done or handled because they're afraid, and so making sure that you're having those conversations so that people aren't put at risk, but also that aren't putting off things that should be taken care of. And in general, the biggest thing to consider when drafting your plan is when people will come into, contact with those in your business, outside of your business, and just making sure you can limit it. Find the most heavily trafficked areas and what people touch the most. Make sure you have it under control. Have a container for used pens so that people aren't touching the same items. Think of everything. I mean, you really have to, like I said, get creative in this. It's most certainly something that needs to happen. And then obviously there's, several resources that are available to people simply by looking up, the CDC, state-specific things. There are some resources here listed here. These are just, obviously because we've got offices in these areas. So feel free if you're a client that needs data from these locations, hopefully you can jot down these resources if you haven't already checked them out. But for everybody, backtoworksafely.org is a great resource for, helping you to develop these things. We also say reach out to your local HR resources. If you don't have that, we have it. So reach out to us to get that. Your payroll specialist can direct you to about 3 different options that we have. So make sure that you're checking out those resources. And if you live in a state aside from the 3 listed, obviously Google it, state name COVID-19, click the .gov website, and it'll bring up any information that you possibly need. Lastly, to wrap it up, here's some great information as far as who to contact. Me, you can contact your payroll specialist. They will have a lot of information at their fingertips as well. Our website, journeypayroll.com, we've got a COVID-19 resource center. Your online access, there's some COVID-19 dashboards in there. Please check those out, especially if you need the PPP and need information for that. You can most certainly go to that and check that out. That takes care of it for today. As always, I encourage you, if you've got questions, reach out. Please don't hesitate. These are times that we need to make sure we're staying, in line with what we need to, and that we're able to give resources where we can and get things taken care of. So please feel free to reach out to your payroll specialist. Miss Evelyn, you are so welcome. I had a question, thought it was a question. It was just a comment. Evelyn, you are so welcome. I'm so glad you attended today. This is something we're constantly trying to stay in front of you guys with whatever information we can. And so thank you for attending. Thank you for being here and giving your time. This is recorded, so if anybody needs it, it will be put up on our webinars link on our website. And you can share it with anybody as well. So I hope everybody has a great rest of your day, a great rest of your week, a happy weekend, a happy 4th of July coming up. I cannot believe that we are nearing July. This just blows my mind that 7 months of this year have flown by. So again, thank you all so very much. We look forward to seeing you next month. Take care.